Hi, this is Dr. Cliff Gronseth coming to you with another Cliff's Riff. Today we're going to be talking about back pain. As you know, back pain is ubiquitous around the world. I'm going to give you a tour of the body, main causes for back pain, and we'll review a little bit of radiology along the way just to show you some examples of what things look like and how painful they can be. So, as I explained, this is all about the body and all about kind of life hacks for trying to keep yourself healthy, keep yourself on the go. We're going to be covering many different topics in these weekly or bi-weekly webinars, so stay tuned. Today, back pain. If you haven't had it, you're beating the odds. It's most likely that one day you will. It doesn't always mean that it's dangerous. It's just part of life. I'm going to give you a quick tour of the spine, and we will run through some of the big red flags of things that you want to avoid if you're feeling back pain. So let me run through some of the layers of the spine here and get you oriented. So as you know, many muscles in the back. As we peel away the layers, you'll see layer by layer just how complex the spine is and its movements. Yep, as we dig deeper and deeper, we will focus today mainly on the lumbar spine, which is the area of the spine that has no ribs attached. The thoracic spine in the upper back has ribs attached, a little bit more stable because you've got the surrounding ribs. And then, of course, you've got the neck or the cervical spine up above. We'll address those in a different webinar, but today, let's talk about low back pain as we know it and as we categorize it. So basically, there are three main categories of back pain. One is just the mechanics of the back pain, just the intersection of the bones relative to each other. And there's big shock absorber spaces in the middle here, which is where the discs run. And those, as you know, can get damaged. Let me throw those in there. So you can see you've got the disc spaces in between the vertebrae here, but you also have these small little joints in the back called facet joints. The fancy word for that is zygapophyseal joint. That's the $100 word that I went to medical school for. But the idea is that the spine is like it's like a stacked set of boxes. So if you take a bunch of cardboard boxes, you line them all up and you try to balance them on each other, it gets fairly complicated. Now, sometimes the bones themselves will start to break down. That's a big deal. So if you've got a fracture, almost like a broken bone that you can get with trauma, you might end up with something which is very, very painful. Bone fractures are very painful. You move in any direction, you'll know that it hurts. It's not subtle. Sometimes as we mature, as we age, the bones get a little thinner and your bones will spontaneously break, not just with trauma, but just because they can't take the load. And that has to do with osteoporosis. We'll talk about that another time. Sometimes the bones will break to the point where they actually start to kink the spine. Not a big deal unless it's starting to pinch the nerves in the spine. That's a big deal. We always protect the nerves. The bones will usually heal if you give them time, but the nerves we always protect. Sometimes the bones will have broken, oftentimes in childhood. If you've been an athlete in your younger years, the growing spine oftentimes can't take the heavy loads. For people that do a lot of back extensions, gymnasts, divers, front line of the football team, they can sometimes get these spontaneous fractures of their spine. It doesn't manifest possibly until later in life. Sometimes the body will heal the fractures. You can see this one takes a nice curve through the bottom of the spine. Doesn't necessarily mean that there's symptoms. In between the bones are little shock absorbers, the discs. I think of them like water balloons. They're not really water balloons. They do have a soft center gel, which is almost like a hockey puck with gel or kind of thick viscous material like epoxy inside of each disc. When the disc wears out, it'll start to leak this material, and the body, interestingly, does not recognize this material as part of you. When you were born, this little gel center of all the discs in your body were protected from your immune system. It has no blood supply inside of the discs, so your immune system does not recognize this material as you. When it leaks out, it says, well, that's a foreign body in my inside of me. I'm going to attack it. And when it attacks it, the body will cause a lot of inflammation around that disc material. And if the nerve gets too close to that material, it will get inflamed because it gets too close to the fire, so to speak. Your body will attack that material. It will gobble it up, kind of like Pac-Man, for those that know what that is. And it will eventually remove that material from the spine. If it doesn't and it becomes bad enough, you might have to get surgery to have somebody physically remove it, but usually the body will take care of it. The issue, again, is if it causes nerve irritation or nerve damage, that's a big deal because we always protect the nerves. The body will oftentimes heal the rest of the stuff. So if you look at a normal MRI, you can see the gray boxes here, which represent the bones or the vertebrae, and in between are these nice white oval-shaped, well-sealed discs. You can see that they have a nice black edge. That is the edge of the hockey puck, and inside of that is this watery gel or this thick hydrous gel. Sometimes the disc will start to wear out. With time, that happens. And if you look closely, you can see this disc is starting to bulge. Bulging is not a disease. Disc degeneration is not a disease unless you call aging and birthdays a disease. But this will happen with time. The integrity of the outer layers of the disc will start to break down, and this disc material will start to creep outwards to the point where it actually can leak out. And when it bulges out or leaks out, it can cause trouble. You can see this disc right here has very dark center. It's bulging out. Here you've got a fairly normal couple of discs above it. This can cause the sciatica or the irritated nerve. Sometimes the disc material will kind of blop out and hang out inside the spinal canal. Sometimes it'll even dissociate from the mother disc, and they'll be floating like a free fragment inside the spinal canal. Not a big deal unless it starts to cause nerve problems. It can cause a lot of pain. Mother Nature will usually take care of this, but if this starts to affect the nerve function, then we sit up taller and we pay attention. The other possibility is it causes a little bit of narrowing in the spine. Again, not a big deal unless it's starting to squeeze the nerves. Then we take notice. You can get pain from discs themselves. You can see in this MRI that this disc right here, they're all worn out, obviously. They look like melted ice cream cakes, but you can see that this disc level here has some white edges to it in the bone. That means that the bone is irritated. It's got a little bit of fluid or edema in there. Not happy. It might be because it's got a little bit of instability because it's lost some of that cushion from the disc. The spine in some folks will wear out just spontaneously based on your genetic makeup, sometimes your activity level. Some things are out of your control. It doesn't necessarily mean that it causes pain, but it can be debilitating if it pinches on nerves or causes mechanical. This poor soul walked around, came in with a hitch and the giddy up. Wasn't much, didn't even know where to start with that one. So with time, the disc will wear out, the bones will wear out. Just having birthdays you're beating the odds if you haven't had any kind of wear and tear of the spine. This is a beautiful looking spine. Here's one that has kind of gotten crusty over the years. You can see the body trying to repair itself by growing little bone spurs and bridging the bone together to the point where it actually will grow even and fuse the discs, the bones together. You can see here on a zoomed in image, this x-ray shows that the body in this person has literally just auto fused the spine just to protect itself. So let's go back to the anatomy of the spine again. So the spine is like stacked boxes, or sometimes I use the analogy of stacked tricycles. You've got a big wheel in front and you've got two little stabilizer wheels in the back. And that's similar to this explanation I showed before, where if you have the vertebrae, you have the vertebrae by itself, and you can see it's got these small little stabilizing joints in the back here. Those are like little support structures to keep the spine from spinning on itself and allow you to bend so you don't end up like a stiff broomstick, kind of like the patient with this fusion that happened. They can't bend much because that's all bone. So those little joints are called facet joints. Facet joints are notorious for causing back pain. They get like little rusty hinges in the back, and they cause most of the pain in the back, especially if it's one-sided. If it's both-sided, it may be the disc wearing out. If it's one-sided, oftentimes these little joints are the culprit. So what do those look like? Well, if you look at a cross-section of the MRI, you can see you've got these tiny little joints back here. You can see this kind of Oreo cookie looking figure here. I'll blow it up. You can see this little white center. That's water in the joint. And then it's surrounded by the two pieces of the bone, the vertebrae from above, vertebrae from below, and it's got this nice little smooth joint. Sometimes those joints will start to wear out. You can see that this one is starting to get a little wave in the joint space, starting to degenerate to the point where sometimes they get like double stuffed Oreos. They just get full of fluid. That's your body, again, trying to lubricate or heal that worn out joint. And sometimes they will not just fill up fluid inside the joint, but they can bubble up little cysts, little bubbles, like squeezing a water balloon in your fingers, and it pops up between, and they can sometimes cause these little cysts or bubbles to start pressing on the nerves. Again, nerve pain, not a good thing. So what do you do about the back? Well, old school used to be bed rest. No more. You don't want to stay in bed if you can help it. If you can keep moving, because that is going to help the body get things stabilized and loosened up. Now, the muscles will sometimes get aggravated, but you try to keep stretching as best you can. The core stomach muscles are the key ones that stabilize the spine, but the idea is that just moving and getting yourself like this is really the goal for preventing back pain. But even these types of folks will get the back pain. The key is to move as much as you can. And then for prevention, the idea is abs of steel. You want to get the stomach as strong as possible, because those muscles will wrap around your torso. They attach to the spine and they act like strings on a tent. If you think about a tent with loose strings, it's going to flop around in the breeze. If you think about a tent with very tight, taut strings, it can withstand fairly high wind pressures, and that is proven to help prevent back pain. I also think of the stomach muscles as, if they're strong, like a solid can. If you try to compress a can, it's not easy. If your stomach muscles are weak, you end up crushing it quite easily. The other thing that people talk about is flexibility. Yoga can be good if it's done well. Pilates is great because it really is focus strengthening. You don't necessarily have to be able to touch your foot to the back of your head, but the idea is prevention is stretching as much as possible, especially the hamstrings. The hamstrings are the key muscles that if those are tight, then the load or the tension when you bend forward will go immediately to the back, which is what's going to stress those discs and those facet joints. What are the big red flags? Well, pain at night. If you have night pain, especially, that is not helped by changing your position, if it hurts more at night, that's a big red flag. You want to get that checked out. If you have unexplained weight loss or weight gain, it's unexplained, not because you're not eating or if you're eating too much, but simply because you don't know what happened, but you're losing weight, it should be checked out. The other thing is bowel or bladder changes. If you have the difficulty urinating, or if you, in the usual case, are incontinent for no reason, I'm talking about just sitting in a chair and suddenly you're wet, not climbing stairs or lifting a heavy object and you have a little bit of an accident. This is a big deal. It means the nerves are getting too much pressure. So the bottom line is you want to try to keep moving as best possible when you get a back attack. And if you're not sure about exactly what's going on, if it's not getting better on its own, definitely get it checked out, especially if you've got any type of neurologic symptoms such as numbness, weakness, changes in your bowel or bladder control. All right. Hope that's helpful for you. We'll see you next time on the Spine West Cliffs Riffs, and hope that you have a good couple of weeks. Take care.